May I say good morning to everyone. We are pleased to be here today. As many of you know and appreciate, the reopening of the Martin Luther King Medical Center has been a very, very high priority for many of us who are advocates for the quality of health care throughout the county of Los Angeles. It is essential to efforts to provide quality health care and access to the residents of the 2nd Supervisorial District to strengthen the county's system of emergency medical services and to essentially reinforce the service safety net, the human service safety net here in the county of Los Angeles. It was a major issue during the recent election, and I intend to make it a public policy priority for stakeholders, some of whom you see here this morning, representing the medical profession, representing healthcare advocates, representing the Hospital Association, representing organized labor in terms of those who work in this facility and facilities throughout the county of Los Angeles. These are stakeholders broadly defined. These are they who are providers of health care in both the public and private sector. All of us have a stake in the outcome of the reopening of the Martin Luther King Medical Center. Consider this day one of my service on the Los Angeles County Board of Supervisors. I will go to the board meeting this morning, introduce a motion that essentially communicates both in symbolic and substantive terms our full intention to cause this medical center, this complex, to be reopened to service the needs of the constituents of the Watts Willowbrook community, but to be a part of the health safety net in the county of Los Angeles, as all of us know and appreciate is very, very fragile. And so the work on the reopening of the Martin Luther King Medical Center will be defined by a higher degree of leadership, accountability, and transparency. Within the first quarter of the new year, we will reconvene here at this facility to cause the community and the range of stakeholders broadly defined to have a full sense of the progress that will have been made, whatever that progress is. And so this morning I'm here to announce my intention to present to the Board of Supervisors a motion to instruct the county's CEO, the Department of Public Works, the Department of Health Services to develop a plan to meet the seismic standards necessary to provide on an initial basis a 120 licensed bed inpatient hospital. The motion will call for cost estimates, a schedule to conform the existing MLK Medical Center campus facilities, or to construct, as the case may be, new facilities to meet earthquake safety standards required under existing law, necessary to include the beds and emergency room, multi-service ambulatory care center, and necessary hospital support services, and to report back to the board within the next 60 days. I said within the next 60 days, with the cost estimate and a schedule for our consideration. It is my hope that this action will accomplish at least two things. First, efficiently build out an existing wing of the hospital facility that meets seismic safety standards to accomplish the goal of the initial 120 beds to effectively jumpstart the efforts to reopen this medical center by addressing the fundamental questions of seismic retrofit requirements. Safety first, patient care first. We cannot talk about having a hospital that does not comply with the necessary rules, regulations, and laws that inform what it means to have a facility that is first-rate, 21st century ready, and all of the things that that would entail. This motion will result in information that will provide the board with the data necessary to evaluate those costs and timelines for once again reopening the Martin Luther King Medical Center, and the basis for which we will evaluate progress. This is a fundamentally important step in jump-starting the process. I see no reason for delay. The longer we delay, the more patients will be denied. And to the extent that that is the case, it affects the Watts, Willowbrook, and the surrounding communities, but well beyond that, it causes the safety net here in the county of Los Angeles to be more fragile. This is a very complex set of issues that we must engage in terms of the reopening of this medical center. We are taking this step because it is one of the understated issues that has to be addressed in the effort to move an agenda forward. Interpret our being here this morning as our intention to make sure that there is laser-like focus on the issue of reopening the Martin Luther King Medical Center. We declare that nothing else is acceptable, and to that extent, we're on our way to do precisely that. So we thank you for this time to be here, and we'll be glad to answer any of your questions.